Understanding this can help married couples trying to conceive to determine the best time to attempt pregnancy. One key question is, on which day of a woman's cycle does the cervix open? If intercourse occurs on this day, sperm can easily enter, increasing the chances of conception. Though it might seem complex, this video simplifies the concept for you. My name is Dr. Tahir, and before we proceed further, please subscribe to the channel. Every woman has a specific day in her cycle when her cervix softens and opens, allowing sperm to enter more easily. This phase is known as the fertile window, fertile period, or ovulation day. During ovulation, the ovaries release an egg ready to meet sperm. This fertile period begins 2 days before ovulation and lasts for about 5 days in total, spanning the day of ovulation and the 2 days after. During this time, the cervix becomes softer and more open, allowing sperm to travel through with ease. How to calculate the fertile period? Know your cycle length. If your menstrual cycle is regular, ranging between 21 to 35 days, this method will work for you. Regular does not necessarily mean a cycle exactly 28 or 30 days long. A cycle of 21 to 35 days is considered normal. Mark your menstrual start date. Record the first day of your period. For instance, if your cycle is 28 days long, count forward 28 days to find the start of your next period. From this date, count back 14 days to determine your ovulation day. Include the fertile window. Add 3 days before and 2 days after ovulation to calculate your fertile window. For example, if ovulation falls on the 14th day of your cycle, the fertile window spans from the 11th to the 16th day. Intercourse during these days maximizes the chances of conception. What happens? During ovulation. Leading up to ovulation, hormonal changes cause the cervix to soften and produce more cervical mucus. This mucus becomes slippery and stretchy, making it easier for sperm to swim towards the egg. If your cycle is longer, for a 35-day cycle, count 35 days from the first day of your period to predict the next cycle. Subtract 14 days to find the ovulation day. For instance, ovulation might occur on the 21st day, with the fertile window spanning from the 18th to the 23rd day. Intercourse timing. During the fertile window, aim for regular intercourse, ideally every other day. Sperm can survive for up to 5 days inside the female body, so even if you skip a day, sperm from earlier intercourse can still fertilize the egg when it is released. Understanding the menstrual cycle. A menstrual cycle begins on the first day of a woman's period and ends the day before her next period starts. The average cycle length is about 28 days, but it can vary from 21 to 35 days. Menstrual phase, day 1 to 7. This is when the uterine lining sheds, resulting in a period. Hormones like estrogen and progesterone are at their lowest levels. Follicular phase, day 8 to 13. The body starts preparing for ovulation. Estrogen levels rise, helping to rebuild the uterine lining and stimulate the release of an egg from the ovary. Ovulation, day 14 for a 28-day cycle. The most fertile day of the cycle, ovulation occurs when an egg is released from the ovary. The egg travels to the fallopian tube, where it can be fertilized by sperm. Luteal phase, day 15 to 28. After ovulation, progesterone levels rise to support a potential pregnancy. If the egg is not fertilized, hormone levels drop, and the cycle restarts with menstruation. How to identify ovulation? Without a calculator, you can identify ovulation by monitoring changes in your body. Cervical mucus. As ovulation approaches, cervical mucus becomes clear, slippery, and stretchy, resembling egg whites. This helps sperm swim towards the egg. Cervical position. The cervix becomes softer, higher, and more open during ovulation. Basal body temperature, BBT. A slight increase in BBT occurs after ovulation. Measuring BBT daily can help track ovulation over time. Ovulation pain, Mittelschmerz. Some women feel mild cramping or discomfort on one side of the lower abdomen during ovulation. Ovulation test kits. These kits detect luteinizing hormone, LH, levels in urine, which surge just before ovulation. Optimizing conception. To maximize the chances of conception. Timing. Intercourse. Begin intercourse a few days before ovulation and continue until 2 days after. For most women, this means having intercourse every other day from days 11 to 16 of a 28-day cycle. Healthy lifestyle. Both partners should maintain a healthy diet, exercise regularly, and avoid smoking or excessive alcohol consumption. Track cycles. Keeping a journal of your cycle can help predict ovulation more accurately over time. Tips for women with irregular cycles. For women with irregular cycles, pinpointing ovulation might require more effort. Using a combination of ovulation tests, tracking cervical mucus, and monitoring BBT can help determine the fertile window. Consulting with a healthcare provider is also beneficial for personalized advice. Summary. Ovulation typically occurs 14 days before the start of your next period. The fertile window includes the 5 days leading to ovulation and the day after. Knowing your cycle and understanding the signs of ovulation can greatly increase the chances of conception. For additional tips and guidance, subscribe to the channel and turn on notifications. Let us help you with your journey to parenthood. Stay tuned for more insights and advice in upcoming videos.